All right. Hi, everyone, and welcome to the Springs Municipal Advisory Council meeting. It's August 24th, 2021, and it is 6:30 p.m. And we are joined by our council members, and we have some guests here today to share information with us. So we're super happy that you could all be with us today. So thank you for taking the time out of your busy day. Vice Chair Willett, will you please call roll call?
I will. Council Member Reyes. Council Member Goldman.
Here.
Council Member Lombard.
Here.
Council Member Perot.
Here.
And Council Member Alcaraz will be joining us a little later. And Chair Iturri, you're here and I'm here.
Thank you so much. The question and answer and chat are turned off for this meeting. We know we've had some requests to keep it on. It's still an ongoing conversation, but they are turned off at this time. We will, if at any time it appears that this meeting is being hacked or bombed, we will end the transmission. And if you have, I just want to remind council members to include Karina in any communication, and she will push that communication out to us if need be. So just a couple of reminders on protocol. We will move to approve minutes. Has everyone had a chance to review the minutes? Is there a motion to approve?
I'll make a motion to approve the minutes of our last meeting.
Great. Ray, is there a second?
I'll second. Oh.
Okay, we have Avram and Iris second. All in favor?
Aye.
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 Okay, excellent. Thank you. Okay, public comment. It's time for public comment for anything that is not on the agenda. We have Spanish interpretation. Hay interpretación en español. Si oprimen el icono en la parte de la derecha, pueden escuchar esta junta en español. Are there any public comments at this time on items that are not on the agenda?
Those members of the public who wish to make a comment, please use the raise hand feature and we will allow you access to make your comment. Chair Iturri, I need to know the time. You want to allocate? 2 minutes, okay. Para los miembros de la comunidad que desean hacer un comentario, por favor de utilizar la aplicación de levantar manos, se les otorgará el acceso para hacer su comentario. Por favor, tendrán 2 minutos para hacer su comentario y diga su nombre para el récord público. Erica, please state your name and you have 2 minutes to make your comment.
Good afternoon, good evening all. Thank you so much for having me. My name is Erica. I'm an employee and community member, an employee of the Sonoma Ecology Center. We are doing this is 2 event announcements. One is confirmed and the other one is loosely scheduled for early September. The first is a creek cleanup as a part of the Coastal Conservancy's Coastal Cleanup Day. That is all happening all over the county, but here in District 1, we're going to be cleaning up at Larson Park. In fact, a huge shout out to Springs MAC member Hannah Perot, who's leading one of the cleanups that we are scheduling as a part of that event. There will also, there's like maybe 1 to 5% chance that this won't happen, which means 95% chance we're doing a bulky item event at that same site in partnership with Recology, Regional Parks, Sonoma Valley Rotary Club, as well as many more. We will have a volunteer sign up on Sonoma Ecology Center's website for that. That will be, again, that's a Saturday, September 18th, and I believe that's from 10 to noon for creek cleanup, and bulky item drop off will be from 9 to 1. And we'll close up sharp at 1 o'clock. I'm going to be looking to do some outreach, and so I'll contact Springs as well as our supervisor and all supporting staff. Okay, and then the tentative event is loosely scheduled for early September. It is a Montini stewardship program, and I'm going to copy the link in the chat for anybody who is interested in signing up to volunteer. This is after a number of fire events that have happened on Montini Open Space Preserve, and this effort will allow us to meet as a group and to clean up some of the abandoned encampments. There's a number of sites that are fairly good and a number of sites that are hard hit. And that is I might be past my 2 minutes. I really appreciate it.
Just a few seconds. Thank you, Erica.
Thank you.
Of course.
I don't see any more raised hands at this time.
Okay. We will close public comment then. Okay. The next is community event announcements. I think Councilperson Willette had at least one. Is there any other community event announcements? Mari Carmen?
Yes. On behalf of Sonoma Valley Community Health Center, I would like to announce that additional doses are now available.
We lost you.
Oh, can you hear me?
Now, yeah.
Yeah. Oh, okay. Sorry, I wanted to just give a community announcement on the vaccine clinics on behalf of the health center. We are now currently taking additional doses, which are as of August 16, only for immunocompromised individuals that will need to sign an attestation. Booster shots for everyone else would be available on September 20th. So just wanted to let the community know that. Thank you.
Thank you, Mari Carmen. Ray, did you have something you wanted to share?
Yeah, on September 1st from 4 to 6 p.m., it's a Zoom meeting. The Advisory Redistricting Commission, which I'm on, will be holding a meeting that may be interesting to our members and audience here, and it's going to be on the tools. Basically, it'll cover the rules and the tools that we're using to come up with the new districts or any adjustments that we have with that. And they really would like public input on this. So the way to provide public input is to use these tools. So if anyone's interested in that, I'll copy the link in the chat.
Thank you, Ray. Is there any other events that need to be shared? Karina?
Just want to make an invitation to our upcoming Charla Comunitaria on September 9th. Stay tuned for details. It will be posted on Supervisor Gorin's Facebook page. September 9th at 5:30. Thank you.
Thank you, Karina. Okay, we will move on. Oh, I'm sorry, was there something else?
Oh, I just had one more. This is Celia with Sonoma Valley Hospital. A little late here, but I just wanted to say that if you haven't already, to please check out Sonoma Valley Health Partners website for local testing and vaccinations. And there is going to be a clinic on September 1st from 10 to 1, where we're going to be combining testing and vaccinations. So you'll find that at the svhpvaccines.org site. Thank you.
Thank you, Celia.
I'm going to go back, Chair Iturri, if I may, to piggyback on what Celia is saying. A reminder to the community, we do have testing available in the Springs, Monday through Friday, 8 a.m. to 2 p.m. at the Fiesta Plaza Shopping Center. With curative, appointments are encouraged, but not required. And you can also get tested on Sundays from 8 a.m. to 1:30 p.m. at the Park and Ride parking lot next to La Michoacana. With curative again, please make an appointment if you're able to.
Thank you,
And
Karina.
I want to acknowledge Dr. Mase and Jesus have connected as well.
Great, thank you so much. I referred many people to Fiesta Plaza today, so. Okay, that's a great, thank you to the county for putting that in place. So I'll move on to the update, or my update, unless there are more community events. Okay, all righty. So a big shout out to Bob Taylor and KSVY. They are transmitting in English and Spanish for us, so we're super, super grateful for that. So thank you so much. And also always to Jordy for interpreting and Lynn Marie for note-taking. Amazing support staff we have here. And of course, Karina for all the work that she does to make sure this meeting goes off without a hitch. So I want to talk a little bit about the annual report. I'm not going to present it in its entirety. I'm just going to talk a little bit about it. You should have all received it. We are in the middle of still making some edits to it, and that's just grammatical and verb tenses, but the report is complete. It's only taken us a year, but you know, stuff's worth waiting for. So the report really identifies the it talks a little bit about how we formed our ad hocs. There are accomplishments, which include the review of potential shelters, the temporary evacuation points, the development of the Fire Safe Council, the Connex trailer, which was placed at Altamira. So that was very exciting. Map your neighborhood, ongoing emergency preparedness for the Springs. We have done pop-up clinics for vaccination. We've worked on traffic issues, and we've also had several different presentations from the county that include annexation and incorporation. So there's, just a number of other presentations, which are really pretty thoroughly outlined in the report. And that's that is the bulk of the report, talking a little bit about what each of the ad hocs have accomplished. We're talking about who has come to present to us and the information that we've been able to share with our community. Then the report also provides, I think the ad hoc committees are the Emergency Preparedness Committee, the Fire Safe Council, and the art ad hoc. And then it also lists all our agendas and our agenda items. So that is the bulk of the report. And we do need to approve it so that we can pass it on to the county. So Supervisor Gorin, who I see has just joined us. Thank you, Supervisor Gorin, for being here. So Supervisor Gorin can take this report to the county for presentation and their approval. And I know many people have looked at it and contributed to it. So thank you all. It's definitely been a group effort.
Do we need to move to approve?
We do.
Okay, I would move to approve the annual report.
I'll second that.
Thank you. Thank you both. All in favor?
Aye.
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 Karina will work on those final edits that came through today and have it ready for you by end of week. Great, thank you. So we have 2 vacancies. Joanne Brown has resigned, so we do need a SVCAC representative. And we also have another vacancy, and we are accepting applications. We've so fortunate to have Hannah and Jesus join us recently, but we do have a couple of vacancies still. And the last item in my chair report is the bylaws revision, which I'm going to turn over to Karina to go over, which is another item that will be given to Supervisor Gorin.
There we go. Thank you. Just a quick update. There were some revisions to your bylaws, and once this is approved by the Board of Supervisors, you will all receive the updated versions. In summary, these are the areas where revisions were made: authority and purpose revisions to remove use permit, membership revisions to requirements, geography, composition, interviews. Under requirements, change language to include members must reside or work within the boundaries of the MAC. Geography, change language to make clear that appointing authority will strive for geographic, ethnic, and other measures of diversity when considering at-large appointees within the boundaries of the MAC, which include Agua Caliente, Boys Hot Springs, El Verano, and Federers areas. Composition, changed composition of the MAC to 9 members as follows: 1 SVCAC representative, 6 at-large, and 2 at-large alternates. Interviews, changed language to include interviews to be conducted by Supervisor Gorin and the Springs MAC Chair and Vice Chair. Apologies. Membership revisions continued under terms, change language to allow Supervisor Gorin to appoint for additional terms. Administrative roles, chair and vice chair, change language to allow council to recommend and Supervisor Gorin to approve additional years as chair and vice chair roles. Effective date will be September 14th when this item will go before the Board of Supervisors. Thank you. That is my report.
Thank you, Karina. Some of this was prompted by, we had initially identified people to represent certain segments of our community, and we felt that that was no longer really needed. So that prompted some of the changes. And once we started looking through it, there were other things that we needed to change. So that's how that change came to be. Are there any comments?
What was the change with the relationship to the, we no longer, we no longer see use permit applications and planning topics when referred by Sonoma Valley Citizens Advisory Council?
That's my question also.
You have to keep in mind that the MAC does not have land use, and that was primarily.
I
It's
do
just
understand that.
Neither does the CAC. Neither do they.
Yes.
They're
and-
advisory as well. Everybody is.
And the other thing is that, you know, the Springs communities are our turf, and we understand it best, I'd say. There are a lot of members that represent different parts of the valley on the CAC, and that's my concern. We have enough oversight by entities that don't actually know the Springs. And it disturbs me that we would lose the opportunity to comment at least on things that really are important, and we know, at least from on the ground, better than people on the county level.
Thank you for your comments. Avram?
Yeah, I would just like to sort of second Iris's position. We do live here, and at least we should be aware of what's happening in the Springs. And as an advisory group, we need to give advice. We know we don't have land use, we can't legislate, I understand that, but at least we should have some input to the Board of Supervisors, not a recommendation, but just in an advisory capacity. So I'd like to see that stricken.
So Karina, maybe we could take a look at that and see how it's worded and take the comments under consideration.
Yeah, and a couple of things you also need to keep in mind is that based on your bylaws, you do have an SBCAC liaison who is supposed to be updating the MAC on specific projects in the Springs area. And you can still receive presentations on a receive-only basis from, you know, different projects. I know there was a recommendation by Supervisor Gorin for an upcoming project. We don't have the details yet, but you still will be able to receive presentations, again, on a receive basis only.
Maybe
And I would, I'm sorry, excuse me, I would object. We actually don't have anyone on the SBCAC at this moment, and we haven't had until last month. And so I question the ability to get someone to take that place. And the other difficulty is the CAC meeting is the night after we have our meetings, which creates a difficulty.
So I'm going to suggest that we look at that again and be very intentional about how we receive that information and make it clearer in the bylaws, so that people feel more comfortable with that.
Thank you.
Okay. So are we able to take any comment on this, Karina?
You can, yes,
Public?
yes.
I thought I saw a hand up earlier, but I could be wrong. There is a
There we
hand
go.
up.
Okay, Fred, give me a second. Let me set the timer. Go ahead, please.
Okay, good evening, everyone. I was looking at the change in the bylaws that allows Supervisor Gorin to appoint people for, additional terms, and it struck me, I just wondered if that's sort of like, Vladimir Putin being able to appoint people forever. I'm being facetious and joking here, but it seems like that's something that people abuse, and I'm certainly not suggesting that in this case. I'm wanting to be humorous here, that I think the people who are chair and vice chair would deserve to be appointed ad infinitum, but just curious why that would come about. But mostly I'm just wanting to be joking about it. So thank you very much.
Thank you, Fred, for your comment.
I don't see any more raised hands.
All right, more to consider. Should we, what's the best process now, to go back and review and then return this to the MAC at the next meeting?
I
Or
will have,
does it need to go? Is there
yeah.
a sense of urgency, or?
It was really up to the MAC to decide if they could move forward with these changes. But I understand that at the end of the day, Supervisor Gorin can move forward and present these to the board. But I do see Supervisor Gorin on here. Maybe she can clarify that.
Well, I love technology. I have difficulty with my iPad, the calendar, and Ariel worked on syncing my calendars, and I ended up losing all of my email accounts on my iPad. So it's like, oh, I love my life. I'm listening very intently to this discussion, and this has always been the challenging point with the municipal advisory councils. You want to comment, you want to receive presentations, but you are not the official advisory body to the county planning process. So we'll take this back and we'll figure out if there is a way to revise the wording to give you some flexibility. I know that the North Sonoma Valley MAC has been discussing the process and protocol for commenting to the Board of Zoning Adjustments and the Board of Supervisors. And so let's look at the way that they are recognizing this. But I think what we were attempting to do is we'll rethink whether or not the CAC will be referring official comment to the MAC. And I know that that's what you want to do, but I don't know that that is the way the county wants to move forward on this. We don't want to make it extra onerous for applicants. But if in fact there is an opportunity and an applicant wants to make a presentation to the Springs MAC, then absolutely we can make that happen. So let's figure out what the wording is for the bylaws that might allow that to happen. And it may not be the whole loaf, it may be half a loaf, but I hear your intent and your interest in not limiting your ability to comment on that.
Thank you, Supervisor Gorin. Okay, so we'll go back and work that a little bit more. Thank you for your comments. Okay, so Supervisor Gorin, would you like?
I gave you the story of my day. It's been really challenging. I thought everything was good. We got our calendar synced. I was not going to miss appointments anymore. And oops, wait a minute. I don't even have email. So technology, gotta love it. We did have a very brief board meeting today where we discussed in closed session a proposed teleworking policy for county employees once we start moving through the resurgence of COVID. And so we're taking a little bit of a pause to rethink that. And what is the future of work? We're paying attention to how other companies are moving forward and considering teleworking in a post-pandemic age. So any thoughts that you have personally, I would welcome, because we are in a very different world. And we had very short open session consent calendar, but we really focused our attention on a work in progress that the county and Zero Waste Sonoma has been working on for now over 2 years, and that is a ban on expanded polystyrene products, styrofoam in other words. So all of those scrunchy white plates and cups that you might be receiving at takeout restaurants, and actually thinking about single-use plastic bags. How can we reduce the waste stream and eliminate those hazardous materials from our landfill and from common usage that are essentially only used once? So the board did unanimously say, yes, we want to join many of the other cities, including the city of Sonoma, to minimize this waste, this contribution to the waste stream. We know it's going to be a work in progress, always an education and outreach effort, because we have many vendors, restaurants who do use, perhaps unthinkingly, those styrofoam containers that they purchase through Costco and other sources. So it'll be on all of us to help educate them about the waste stream, the landfill, and alternative products that they could use. Many Chinese restaurants now use cardboard rather than styrofoam for takeout. I know we can do that, but it is a learning curve. So that was the action that we took today. A lot of public comment on thanking us for the policy regarding mandating vaccinations for our county employees. It's not the only way. They could have weekly testing, COVID tests, but I'm hearing from many folks saying that they really don't want to undergo weekly COVID tests. So they're going to go ahead and sign up for the vaccinations. And you probably heard today the FDA finally approved the Pfizer vaccine. I'm thinking Moderna is in the pipeline as well. And we know that booster shots are in our future, probably in the next 6 to 8 months. So the county health providers will be working on that, much as they did in the early part of the year. I wish I could say we're through the COVID pandemic, but you've seen the figures, as have I, and most of the folks who end up in the hospital with serious Delta coronavirus infections have been unvaccinated, or often they're vaccinated folks and receive transmission of COVID, especially the Delta variants, from unvaccinated folks. So we're all in this together, and I'm hearing more and more folks desperately ill in the hospitals on ventilators, unvaccinated, with the Delta variant, and the future is bleak for a lot of those folks. So we're going to keep experiencing some deaths moving forward, when we really want to see a community that is safe and open to our visitors as well as our employees moving forward. So that is what I have to report today, and I'm open to questions.
Thank you. Are there any questions for Supervisor Gorin? I see a hand raised.
If there are no hands, or if there are no questions from the council, we will move to public comment. Fred, go ahead.
Yes, I would just like to note that the chat was disabled here, and in almost every other public meeting that I go to, the chat is open and it becomes part of the record. And this is one of the few forums where the chat's disabled, and I just don't understand why that's an issue here, but it's not at the county redistricting meeting, at the groundwater sustainability agency meeting, at the city council meeting, planning commission meeting. Why is it problem here, but it's not in those others. You know, I don't see the harm in it. And a lot of times staff looks at the chat and then answers questions from the chat. So this is just a way of really putting an arm up to the public and saying, we don't want to hear what you have to say. So I think that it's wrong that the chat is disabled at the MAC meeting here, and I would again lobby to have it opened up. Thank you.
Thank you, Fred. Okay.
I don't see any more raised hands, Chair Iturri.
Okay. Any other comments from the council? Okay. All right.
Just take this opportunity to thank you, Maite, Ray, for your leadership on the MAC and all of the MAC members. It's so gratifying to know that, what is it, 3 years ago, we had this vision and it took us a while to get there. And we actually do have a venue for local voices and hearing clearly from local community members. And I'm not sure whether you announced that we did have a thank you, official thank you and a handshake for the emergency preparedness, the Connex containers. Who named that? What a silly name. And so you may report on that later on in the meeting, but I wanted to thank you. And I know Iris was there and all of the MAC members really working on community preparedness. And this speaks volumes about the effectiveness of the MAC moving forward. And even the county said, thank you to the MAC, because they heard us loudly and clearly about the need for emergency supplies stored in the valley. And hopefully we will never have to use them, but we have them, or at least some for a small proportion of the folks living in the valley. We'll get there. So thanks, Maite, for your leadership on that.
Thank you, Supervisor Gorin. I appreciate that. And I appreciate all the support of the community to make it all happen. Iris, did you have a comment?
Yeah, actually, Mari Carmen was also there, and Dana. And somehow Fred did get into the chat and he wants to know if that's your new house. And if, you know, so if it is, yay.
Hey, it is my new house, and I won't know the challenges of trying to get into a new house and all the things that are left undone. You could see outside, I still see sawhorses, building materials, a radio arm saw, a porta potty, and a lot of unleveled dirt. So Fred, bring your rake, come and help us rake out the stones. Just teasing.
Well, congratulations.
Close your eyes at night and not look.
That's right.
Okay. All right. Thank you all so much. Anything else, Supervisor Gorin?
No, that's it. And I will stay on the line and listen in to the conversation. Again, thank you all.
Thank you. So I feel super, super fortunate with our next guest. She's probably one of the busiest people in Sonoma County. Dr. Sundari Mase is here with us to talk to us about COVID-19, and we're very grateful that she's here with us. So Dr. Mase, take it away.
Hi, thank you very much. Let me give you my beautiful virtual background if I'm able to. 1 second. There we go. A picture of the Golden Gate Bridge for all of us for this evening. Well, thank you so much to Supervisor Gorin and Karina and everybody else for having me on tonight. And I believe I'm really here to talk about COVID, the numbers, the metrics, the response, and answer any of your questions, and try to focus a little bit, not only in Sonoma County, but actually specifically on Sonoma Valley. So let me pull up my slides, just a second.
Dr. Mase, I actually have it prepared. If you'd like, I can share my screen as well. And I do have it side by side, English and Spanish.
Oh, okay. Would you prefer that? I mean, I can unshare and have you share. That's fine with me.
If you don't mind, only because we would like both English and Spanish versions on.
Oh, got it. Okay, no problem. Yes, I can do that. No worries. All right. Well, thanks so much, everybody.
Can everyone see that?
It's a little small, but can you make it into a presentation mode more? Or?
There we go.
Fantastic. Okay, that's a little bit. Can everybody see that? We can always, hone in a bit if you need for specific slides. So, okay, great. So let me, if you could go down a little bit to slide 2 or 3, I suppose. Okay, great. So as you all know, as Supervisor Gorin just mentioned, we are definitely in a surge. And the surge is largely driven, as Supervisor Gorin just noted, by unvaccinated individuals. As of today, our metrics show that we have close to 21 new cases per 100,000 residents per day. We have a 6.3% overall test positivity and a 7.4% test positivity in the lowest socioeconomic status quartile. That is the Healthy Places Index lowest quartile, which takes into account about 11 different factors, and every census tract essentially is placed into a number as to where it is along the Healthy Places Index. And then the lower 25%, and this includes things like schools and jobs and availability of health insurance, all these different metrics go in there. So anyways, 7.4%, this actually puts us in, if we were still in that blueprint from the state, we'd be in the purple. We've had hospitalizations that are increasing. If you look at the graphs, and I don't know, Karina, if you can put your cursor on the graphs. Yeah, start with the top left. The new cases per day, going to where we are right now, is about half of where we were during the surge in December or January, but not quite at the very high, but quite high. And our overall test positivity is almost where we were during our surge in December and January. There you go, perfect. We're almost at the very top there. And if you go down to the lowest HPI test positivity on the right-hand side, the other graph, yeah, you can see that also is close to the top of where we were in December or January. And hospitalizations, and this really is the scariest thing, I think, is almost where we were in December, January. We've got 81 hospitalized persons, and at the very top in December, we had about 95 or so hospitalized persons. So next slide, if you can go down a little bit. Oh, and actually going back, 35 people have died of COVID since June 1st. I'm going to show you some information on that in a second. So scrolling down, as you can see, there's a big difference between unvaccinated and vaccinated persons. So the orange line is the unvaccinated persons. And as you can see, unvaccinated persons have about 5 times more cases per 100,000 than the vaccinated persons, which is the blue line. So in order to really understand this graph, you just kind of have to think about this. Unvaccinated persons tend to be in the same geographical locations, and they're congregating. They're hanging out together, they're doing things together, they're gathering together, and they're driving the case rate in Sonoma County as anywhere else in California and the nation. And vaccinated persons happen to come in contact with COVID because there's such a high level of community transmission. So even vaccinated persons are getting COVID. The good news is vaccinated persons are much less likely to get COVID, and vaccinated persons are much less likely to have bad outcomes of COVID. So going on to the next slide, we are going to look at case rates by racial and ethnic group. And you can see American Indian, Alaska Native have the highest case rates, followed by Black, African American, and then Pacific Islander and Latinx, and so on and so forth. Why is this the case? Because our numbers of people in our community in Sonoma County that define themselves as American Indian or Alaska Native or Black or African American are very low. So when you look at a rate per 100,000 residents, the rates are very high, still very important, but that explains why they're so high up there, because the actual numbers of people are so low. The denominator is low, so the rate is high. You can see it's been a trend upwards over the past 60 days. Next slide. This actually is very specific, and I know it's really hard to see this, but this is case rate trends by city. And I'm going to have to screen to read this myself, but I believe we have, let's see, you might have to help me with this so I can see it myself. Thanks. I appreciate that. Great. Okay. Cloverdale on the top left. Guerneville is next to it, Healdsburg. Then we have Petaluma, Roanoke Park, Santa Rosa, Sebastopol, Sonoma, and Windsor. Remember that that here we have the greatest number of cases in Santa Rosa, Petaluma, Roanoke Park, and Windsor. But if you look at population size, because that's actually what this graph is about, that's the case rate, 7-day case rate, 7-day lag. The case rate is trending upwards in Cloverdale and Sonoma. So let's take a look at Sonoma. So again, these aren't absolute cases. It's the case rate per 100,000 because Sonoma has a lower number of people living there. The rate is higher, but it's still really important to note that the case rate is really going up, as you can see here, over the past 2 months or so. And you can also see that Boise Hot Springs and El Verano, Weinberg, these are places that aren't depicted on these maps, but certainly in Sonoma, all those areas are kind of hotspots in terms of case rate. And we can give further detail in terms of absolute numbers for all the specific areas within Sonoma. And we can share those with you as well. So I guess the bottom line there is simply, and go ahead and go back to the next version, Karina, thank you. The bottom line there is simply that things are trending upwards everywhere, and per 100,000 population, things are really trending upwards in Sonoma and in Cloverdale. Total tests per day, testing has increased by 84% since July 1st. So we are meeting or trying to meet the demand in testing. The current testing is 402 tests per 100,000 residents per day. That's up from an all-time low of about 180 or 200 tests per 100,000 residents per day. And testing has increased for all races, ethnicities, age groups, and geographies. We're trying with the LHI mobile van, we have 2 of them, as well as curative and molecular matrix. Those are our sort of private entities that are doing testing, as well as all of the county's pop-up testing to meet the demand. And we've gone from providing 1,000 tests per week to 14,000 tests per week in the last 6 weeks. So we are scaling up, trying to meet the need. Next, I can scroll down a bit. So where are our cumulative cases happening? Well, as you can see here, it's the age group of really 18 to 34. Those 3 bars in the kind of to the left there that Karina is showing, where our greatest number of cases are occurring. And the most important takeaway is here, it's happening in unvaccinated persons. So it's really that age group of the 18 to maybe 49 or so, where people are not vaccinated. We've done an amazing job with our vaccine team, Dr. Shende, Ken Tassif, and others that have really gotten to the elderly folks definitely over 75, and all those over age 65 as well, that are increased risk for bad outcomes from COVID. So our cases are occurring in the unvaccinated population, as you saw before. That's why the younger ages are represented the way they are. If we can scroll down, this goes to hospitalizations and deaths. I want to reiterate, we have a lot of patients in the hospital. We're almost at where we were in December and January. We've got 81 patients as of today hospitalized with COVID-19, 16 in the ICU. Now, one of the problems is a lot of people didn't seek medical care last year because of COVID. So we actually have more patients admitted due to deferred care. This graph shows us the hospitalizations of COVID-19 patients. There's an increase in hospitalizations of patients for all other illnesses, whether it be heart attacks, diabetic complications, infections. All of those things are overrepresented because people didn't seek care last year. 79% of the patients hospitalized and in the ICU are unvaccinated. So again, it's definitely the unvaccinated that are driving the trend of everything: case rates, test positivity, and hospitalizations and deaths. You can see that 98.3% of all COVID-19 deaths throughout the pandemic and 95.7% of the deaths since vaccine became available January 1st have been unvaccinated. So the good news is if you're vaccinated, you might get COVID. It's less likely, 5 times less likely, but you're not going to get sick. You're probably not going to get hospitalized, and you're almost definitely not going to have an outcome like death, because that's what the vaccine is preventing. Of our, say, about 6 or 7, I think, persons fully vaccinated that have died of COVID, I believe about 5 have been over the age of 90, and the other have had significant underlying medical conditions such as end-stage renal disease. If you can go down a bit, Karina. Now I'm going to go into vaccine administration. I'm very proud to say that 81% of Sonoma County population aged 12 and over are at least partially vaccinated. And in fact, 73% are fully vaccinated, 8% partially vaccinated, meaning that they need to get the second dose. Now, I think this is underreporting because it takes a little time to get all the data in the system. So my thought is probably half of those that are here showing as partially vaccinated actually got their second dose, but they're just not in the system yet. So we're doing quite well, as all Bay Area counties are, and much, much better than the national average, which I believe is about 61% fully vaccinated, and maybe an additional 8 or 9% partially vaccinated. So we're excited about that. We're looking forward to approval of the emergency use authorization for kids 2 to 12. And of course, as Supervisor Gorin just mentioned, we have full FDA approval now of Pfizer, and hopefully the other vaccines are not far beyond, and we'll see more, I think. Again, here, if you look at the proportion of each group vaccinated, it's the younger folks, 12 to 15, 18 to, the 24, really the younger age groups are the ones that are not as vaccinated. So 50% of 12 to 15-year-olds are fully vaccinated, 61% in 16 to 24, 62% of 25 to 34-year-olds. That's the group we need to focus on. We've done quite well in the older folks getting them vaccinated, and that's why we're not seeing the kind of really negative outcomes we're seeing December and January. If we scroll down a bit, we can see the trends in vaccination age group. This is good. Even the youngest age group, that would be the lowest one there, you can see how much we're increasing in vaccinations. They're still only at 50%, but look at how much of an increase we've had. And all the groups show an increase. This is due to the incredible effort that we put into as a healthcare coalition with our hospitals, our qualified health centers, as well as the county and our solo practices, the Sonoma County Medical Association. All of our partners like Cheryl Fox and DEMA have really stepped up to do the job of getting people vaccinated. If you scroll down a bit, you can see by race ethnicity, we're doing better as well. We have seen now that we have a really good progress that's been made. We have a cumulative number of Latinx individuals fully vaccinated that rose by 900 to a new total of 55,516, an increase of 1.7%. That is a group that we're really focusing on, in addition to these other groups that aren't as vaccinated. The multiracial group, people who identify as multiracial, really, we have some work to do in that category, as you can see. But we are making a lot of progress with all of our efforts. Scroll down a bit, you can see our vaccine equity measures are trending really well. Currently, 25% of vaccine doses have been administered to residents in the lowest quartile of the Healthy Places Index. And those are the people who have the fewest resources. 71% of residents in the lowest quartile are at least partially vaccinated, 63% fully vaccinated, and it's looking like the other quartiles. So we're closing the equity gap here. So what is it that we're doing as a state and a county to ensure that we're going in the right direction with COVID? We did have an indoor masking health order that I issued effective August 3rd, which is an order and a mandate for full indoor masking of everybody in any public indoor settings. This includes restaurants, malls, government buildings, businesses, gyms, salons, hair salons, that is, personal care places. All of them are required to have full indoor masking, and businesses are required not only to enforce that, but also to post and entrance and exit the masking requirements. The state passed a vaccine verification order for high-risk settings such as healthcare workers, jails, homeless shelters, congregate settings like skilled nursing facilities, that all staff need to verify vaccination status, not just attest to it, but verify with the actual proof of vaccination. And those who are unvaccinated need to test either twice weekly or weekly, and everybody needs to mask. And we extended this effective September 1st to our fire and law and EMS providers and our temporary disaster shelter workers. And that they are all in agreement with this and are on board collaboratively with the extension of this order in Sonoma County. Our HR in Sonoma County also has adopted a policy requiring employees to also submit verification of full vaccination, and if not vaccinated, to submit proof of a negative COVID-19 test weekly. And we also put out a high recommendation to all Sonoma County employers, businesses, to do exactly the same. Verify employee vaccine status and have routine testing of unvaccinated persons in addition to the indoor masking. There are also some new state health orders. One is a mandatory vaccination for all healthcare workers with compliance by September 30th. All workers in healthcare facilities such as hospitals, federally qualified health clinics, doctors' offices, skilled nursing facilities, etc., unless they have a qualified medical exemption or a religious belief exemption. By the way, the qualified medical exemption is very limited and really only applies to a doctor being able to state that the person actually has anaphylaxis to some components of the COVID vaccine. And we are considering then extending that to some other healthcare worker settings, and we'll know more about that soon. And then we also have moved up the requirement for not just K-12 teachers, but all workers in K-12. That includes volunteers, it includes all staff, janitors, any staff in K-12 to 12 settings. The CDPH health order requires them to submit vaccination verification as well as masking and testing requirements for unvaccinated by October 15th. But we in Sonoma County are moving that compliance date up to September 24th with a local order in conjunction with the Sonoma County Office of Education. We also have a high recommendation for outdoor masking in school settings, for not participating in overnight field trips, and for sequential or serial weekly testing of all students, vaccinated or unvaccinated, with a COVID test, either an antigen test or a PCR-based test. All of the testing actually does allow for either antigen testing or PCR-based testing. One other state order is a requirement for visitors in acute healthcare settings and long-term care settings to either show proof of vaccination status or a negative test result taken 72 hours before entry into that acute healthcare facility, unless you're there for emergency critical care or end-of-life visits. So a lot has been done at the state level and the Sonoma County level with respect to health orders and recommendations to keep our community safe, to ensure that we are finding cases of COVID, getting them isolated, performing contact tracing, and ensuring that the workplaces are safe, that everywhere you go in the county is safe. So I'm going to stop there. That's kind of an overview of what we're doing, and I'll be happy to take questions.
Thank you, Dr. Mase, for keeping us safe. I know you've been working really hard, and it's greatly appreciated, everything that you've done for so long. So we know how difficult your job has been. So thank you. I think we have some questions from the panel, and then we'll go to public comment. Avram, I think I see your hand up.
Yeah, thanks. Thank you, Dr. Mase. It's always so helpful to get these numbers because we sort of sometimes operate in a vacuum and not really knowing. So thank you for all the great information. I just have a couple of questions. First of all, we're almost at 81%, or very close to it once the people get their second vaccination. At what percentage do you feel comfortable that we're going to be able to reverse the direction of the trend? Two, why Sonoma? You probably have some further thoughts on that. And lastly, I've heard in the articles I've read that in other countries that Delta has hit before us, that the surge was incredible, but it was less short-lived, or it was short-lived than the previous COVID-19. So I know it's a lot, but if you could just address them.
Yeah, thank you so much, Ram. I really appreciate those questions. So the question about when we feel comfortable in terms of percentage is a hard one, because unfortunately we have wide differences, even within Sonoma County, in zip codes and census tracts that are vaccinated versus unvaccinated. So if you talk about herd immunity, which a lot of people have, and when we're safe with knowing that the majority of people in a particular area are safe and transmission is not going to occur, you're assuming that it's equivalent everywhere, right? So we know, for example, that Georgia and Alabama, I'm just pointing that out because they're the states that, some of the states that are least vaccinated, Texas as well, they're at much higher risk than California at this point, given the percentage of vaccination. Similarly, in Sonoma County, we have pockets of areas that really are much lower than other areas. So although as you pointed out, 81% overall have at least one shot, and as I showed, 72, either 73%, 72% are fully vaccinated, it doesn't matter because we got some spots where it's like 30%. And those people are hanging out together and gathering and doing things together. So that's where the transmission is occurring. So it's really hard to put a number on the percentage because of the discrepancies around the county itself geographically. And as long as we have ongoing transmission of the Delta variant, which is 60% more transmissible, 1,000 times greater viral load when people are infectious, as long as we have that going on, even vaccinated people are coming into contact with COVID. That's one thing. As far as Delta variant peaking and quickly diminishing, we're not seeing that here. We're seeing ongoing transmission right now of the Delta variant. And I'm not really sure why it may be acting differently in certain communities than others. I think part of it is that we are highly vaccinated, but we've got those pockets where the Delta variant, once it infects one member of household, everyone is infected. Once it, as we saw in the Sam Jones shelter, once one person or a few people bring in the Delta variant, it is fully transmissible, and we see huge amounts of transmission in congregate settings. So it's kind of difficult to predict what's going to happen here in Sonoma because our geography, or the way people behave, the way the Delta variant spreading is different.
Thank you. Ray? You're on.
Got it.
Got it.
Dr. Mase, thank you for your time. Thank you for coming here. And it's a pleasure to have you here and be able to ask you questions. Do we know anything about this new variant and what makes it so? I mean, it looks like when you show us the charts, hospitalizations per infections, if you look at that, this one's, way more aggressive. Do we know any of the mechanisms or any of the geekier side of this? I'll just leave it at that.
Yeah, no, I love the geeky side too. So I think we're still trying to figure out how this mutation then makes this virus so much more transmissible. Part of it is the spike protein. It is a mutation within the spike protein. Spike protein, as you might imagine from the name, is what then penetrates and allows the virus to get in to our cells. And so the Delta variant, you know, viruses are going to do this. They are another organism. It's kind of like life. It's going to try to live. And therefore, when there is a lot of transmission, and in our case here, it's really amongst unvaccinated persons, it gives the virus a chance to mutate. Because more and more and more that it replicates, the more likely you have mutations. And of course, the mutations that confer the ability of that virus to do better, to infect more people, to be more invasive, to create, you know, more disease, are going to be selected for, because those mutated forms then live and survive. So the virus has mutated to be more effective in infecting human beings, and that's what we're seeing. The specific mutations and how exactly they're causing more infection is under study, and we'll have more information on that.
Thank you.
Thank you. Iris, I think your hand is up.
Yes, thank you. I have more than one question. Looking at the numbers of the in the American Indian and Alaska Natives, although I see that there are a lot of them that a good percentage that only have one vaccine, their percentage rate overall, if you don't separate out those two, looked pretty high. And I'm wondering if they are having more COVID infections because of the things that we know about low-income communities having fewer resources and more stress, and wondering what you're thinking about that. I think it's also, the chart's not up anymore, but in the Black community, you know, looking at that. And then I have a couple of questions after that, if you want to do one.
Yeah, I'm sure it's because of inequities and resources. Remember though, the case rate is dependent on the denominator, which is the population. And in Sonoma County, 67%, I believe it's 67% are white non-Hispanic. And I think it's like, is that right? Yeah, 23% are Latinx.
Mm-hmm.
So
yeah.
That means that the other 10% make up everything else.
Mm-hmm.
So our Asian population is like a couple percent, or Black population is a couple percent.
Mm-hmm.
And for American Indian, Alaska Native, it's probably like 1%. Multiracial is like 2 or 3%. So when you have such low numbers in the denominator, the case rate looks really high.
Okay.
Because the denominator is so small. But I agree with you.
Okay.
You know, but you can see the vaccination rates are better in those communities, not multiracial, but in the Alaska Native, American Indian, and Black than they are in Latinx. So you know, these are the trends we're seeing.
Okay. Another question I have, are you seeing people, long haulers in the vaccinated community that do get COVID, or does that seem to protect against long haul?
You mean the long COVID?
Yeah, the long COVID with all sorts of crazy symptoms. Right. And
you know, surveillance wise, we're not really tracking long COVID. Mm-hmm. We're not getting those numbers. That would be something that the federally qualified health centers or the hospitals might have a better idea of. I think it's a very small percentage of people that are getting long COVID. And frankly, the people who get COVID who are vaccinated, many of them are just asymptomatic. They don't have a lot of symptoms. So I think the likelihood of the long, this is just my kind of extrapolation. I don't think there's going to be a lot of long COVID in people who are vaccinated, because the manifestations are much, much less altogether.
Frankly, that's one of the things that scared me, made me really want a vaccine. The other thing is, excuse me here, gotta look again, that I would like to have the percentages for the actual Springs community because we're not the city of Sonoma, and so I don't think we're included. Although I did get, and even the zip code, because the zip code is the same for Sonoma and pretty much all of the Springs, almost entirely. And the other thing is I really do understand wanting to maintain vigilance even though we have 81% vaccinated, because when I consider it, folks that are coming from out of state may not be vaccinated, and they, and maybe they're not so good about wearing their masks. And then people in the hospitality community would be overexposed to those people, and we would be underexposed in, the general population would be. So it makes perfect sense to me to maintain vigilance. So
I agree with you 100%. And we only got the request for specific data for the Springs community today. So our EPIs are trying to pull that together, and we'll look at the zip codes and try to give you that information through Supervisor Gorin.
okay.
Thank you.
I would just say, maintain vigilance. That's what I'm doing. I'm taking great precautions. I don't know how much you want to know, but I'm not going into indoor restaurants right now because I don't feel safe even vaccinating doing so, because I care for my parents who are 84 and 76, and maybe I'll be fine, maybe I won't, but I really want to protect them as well.
Thank you for that. We'll go to public comment unless there's another question from the council.
I do see a couple, sorry.
No, that's okay. I was just going to say the public would like to speak. Their hands are popping up.
Yes. Let me get my timer ready.
All righty. Thank you.
Daniel, go ahead, state your name and make your comment, please.
Okay, thank you very much. My name is Daniel Levitis. I'm a PhD biologist and trained in demography also, and I'm sure that I do not read the epidemiological literature with the same level of insight that Dr. Mase does, but I've been reading quite a lot of it, specifically in relation to the question of how much protection being outdoors provides to the both the original and the Delta variant of the coronavirus. And my impression is that being outdoors is a layer of protection that has been studied somewhat less, but is very clearly protective on the same order of magnitude as masking, on the same order of magnitude as spacing, on the same order of magnitude as being vaccinated. And so I would really appreciate hearing Dr. Mase's view on that, and whether we might be able to protect the community more by having more messaging around having activities outdoors, having teachers teaching outdoors when possible, having cashiers meeting customers outdoors, and so on. I am in all things an advocate for the outdoors, so I may have a bias in this. So I would very much like to hear Dr. Mase's view, please.
Thank you. Dr. Mase?
Yeah, thank you. I do agree that, the risk outdoors is much less than the indoor setting. That's why the mask mandate applies to the indoor setting. And, when unable to keep, say, for example, kids apart, because kids are all together outdoors at recess, they're eating lunch, they're, they're definitely very close. That's why we've done a high recommendation for masking outdoors, even in schools, because we are seeing a lot of cases in schools. But I would agree 100% that the risk is much less outdoors, and we should try to move our activities outdoors. That's why, as I said, if you're going to go to a restaurant, going to an outdoor setting is better. If you're going to have any activity, barbecue, whatever, outdoors is definitely better.
Thank you, Dr. Mase. Karina?
Yes, we have some folks lined up. Fred, then Mario, then Amy. Fred, go ahead.
Hi, Dr. Mase. I'm very glad to be here and able to ask some questions of you. one question I have is that in Sonoma, there's been the event at La Luz that was possibly a spreader event. And then there's like tonight, the farmer's market, I drove by and saw people in very close proximity with no masks on, quite a few of them. And it just seems like that we're kind of between a rock and a hard place between this inertia of having to open back up and then needing to shut down. So I know you're probably not anxious to get yourself back into the whole dynamic of shutting down. I have compassion for you during that time, but that's one question: is how safe is it to have these big events on the Sonoma Plaza? And then also I have a question about Johnson & Johnson and how you see that vaccine compared to others. And my final question is I'm not really anxious to go do anything indoors, and so I'm gonna keep on going as if this was, you know, right at the peak of COVID until I hear otherwise. And would you advise that as well, as to try and stay out of as many indoor settings as possible?
Thank you, Fred.
Yeah, thanks for that. I would agree with you 100% that there's definitely a risk of events, especially indoor events. And that's one reason for the indoor masking mandate. Even outdoors, crowded events can be, you know, super spreader kind of events. So we need to be really careful. Everybody has to kind of watch out for themselves. I actually really think that with vaccination, if we can get, I don't know if it's possible, but if we can get like 95% of our population vaccinated, that we're really going to be able to fight this thing. You know, we need to get there. I don't think right now that shutting down businesses and operations is really necessary. What we need to do is really move towards the mitigation measures, masking, social distancing, and more than anything, ensuring vaccination status. So it's not unrealistic, for example, for businesses to do verification of vaccination for their staff and their employees. In fact, you know, in San Francisco, there's actually a vaccine mandate if you want to go to a restaurant indoors now. So you have to show proof of vaccination in San Francisco to eat indoors. So there's a lot of mitigation strategies which will allow us to keep our businesses open, our economy going, and still address the COVID challenge. I think over time, this is going to, the question is what amount of time, but it is going to dissipate. It's going to become endemic. This is going to become like influenza over time. But we have to get through this period where we still have a lot of people who are unvaccinated and at risk. So I don't know if that helps answer your questions, Fred, but we got to find the happy medium between closing down things, which we don't want to do, and do mitigation measures to help protect the community.
Thank you.
Mario, go ahead.
Hello, everyone. Hello, Dr. Mase. Thank you so much for taking my comment. Mario Castillo, resident of the Springs. My comment is in relation to kind of along the lines of Fred's comment. It's really, I'm really concerned, you know, to see that your presentation and see that we're still on, you know, the lower, you know, 50 to 60% of people being vaccinated. And I wonder, you know, whether the county is actually, you know, doing a good job, or people in charge of getting the information out to people. I'm also concerned in terms of how information is being passed on to, especially the Latinx community. You know, I see every week gatherings, you know, big parties and stuff like that, and it's almost like there's mixed messages in terms of what's allowed and what's not. You know, there is, to Fred's point, there is the farmers market. There was a fundraiser for La Luz. There's all this, so there is a lot of mixed communication that is happening out there, and it's really harming our community. And so I'm just wondering whether we using the Delta just a way to get people vaccinated, and at the same time, you know, people feel like they've been tricked, because somehow, the people in charge are not being honest about, whether the vaccines are actually working, whether, they're just, we will come to a point where COVID would actually disappear. So there is just not a clear message. And I know that Karina's been trying to do a lot of work with the charlas. I checked those out too, and then there's 150 views. There's really not. So I'm just, I just don't see whether there is a clear effort in trying to get the information and really educate our community. I appreciate your time. Thank you.
Yeah, sure. I mean, I wish that Denia Candela, who is our health equity manager, was here and she could address specifically all of your questions and with very detailed response. We have a health equity group that meets weekly, predominantly Latinx. They're helping us with determining where to do our vaccine pop-up, our outreach, our education, how to get the word out through Spanish radio, through different indigenous channels of communication. Our PIO group is trying to put out messages in multiple languages. We are trying to do all of these things. We're also trying to vaccinate, in Roseland. That's one of our spots where we have an ongoing vaccination center. One of the problems is really getting people at the individual level in. And that's where actually, you might be really helpful to go out and get people educated as to why they need to get the vaccine. The vaccine is quite effective. And as I've shown from my data, quite effective in preventing COVID and in preventing bad outcomes of COVID. There's no question about vaccine efficacy and safety. It's a matter of getting that information out appropriately to groups so they can take advantage of the best practices.
Thank you. And our last question.
Amy, go ahead.
Thank you. So first, thank you for doing this job. I hope it's gotten somewhat easier since the early hysteria. And I'm really grateful to have a chance here to ask some questions. I'm totally happy to see some of these mandates coming down with the full approval of the one vaccine. In fact, I've seen some signs in some facilities that say our whole, our full staff is fully vaccinated. And so that's one, I would be more inclined to, go to something like that. Conversely, one of my concerns is about and maybe you can address why there's such a high percentage of both healthcare workers and first responders who are vaccine resistant, hesitant. I needed to go to a doctor's office for something. I asked if the staff was fully vaccinated. I wasn't asked about individual status, and they wouldn't tell me. They wouldn't. And so this whole notion that people, in the healthcare profession would not be vaccinated, I think is actually a sign too that sends a message that, of vaccine hesitancy to the public. So I guess, I don't know if you have any insight about both the first responders and healthcare workers that aren't getting vaccinated and how to reach them other than mandates.
No, I agree with you 100%. And, I can't speak for the entire healthcare workforce, but there is a lot of skepticism in that group. I think now that FDA has fully approved the Pfizer vaccine as of yesterday, that's going to help with getting those folks that are hesitant because they're afraid that the vaccine hasn't been fully studied or fully determined safe. Because, healthcare workers are also going to be skeptical and thinking that there could be really bad outcomes from taking these things, even though we've had so many clinical trials. So I'm hoping that will help. But then there's always a group of people that is going to be, naysayers for whatever reason in every group. That's why there's a healthcare worker vaccine mandate, which is a state order, not a county order, that mandates that without a religious or medical exemption, people can't work. And with first responders, the state hasn't gone there yet, but as you know, in our county, we've put a fairly strict vaccine verification or get tested every week order in place for our first responders that are fire, law, and EMS. So unfortunately, there are multiple reasons why people are vaccine hesitant or even vaccine resistant. And it depends on one's personal beliefs and your influences and where you're coming from, and healthcare workers are not immune to that.
Thank you, Dr. Mase. We'll take final comments from council. Dr. Mase, thank you so much for everything that you've been doing for our community and our county, and very, very grateful for your work, and really appreciate you taking the time to meet with us this evening as well. So thank you so much.
Thank you so much, everybody. And thank you to Supervisor Gorin for hanging in there and doing all that she's doing as well.
Thank
Good
you.
night, everybody.
All right, good night. So we have, Jordy, I want to check in with you. We were going to put a break in after the next speaker. Is that agreeable to you? Okay, great. Thank you. Our interpreter is just as busy as he can be back there. So we just want to make sure that he's getting enough rest. So our next guest is John Henley. He's the executive director of the Sonoma Valley Hospital, and we're super glad to have him here. And we also have Celia here as well, so from the hospital. And thank you for being here.
Thank you very much for having me. I understand that the hospital hasn't come to the panel before, to the committee before, and so I'm glad we're here and able to have a dialogue. And I do hope there are questions or comments for Celia and I when I finish a short presentation to you. I do want to echo Amy's comment on vaccine hesitancy. We've got 500 people that work at the hospital, from doctors to nurses to technicians and service personnel, and I've got 20 odd people that don't want to get vaccinated. And so we're having a dialogue. We're talking about why that is, and there are some medical issues, right, that are valid, and there's nothing we can do about that. But in any population, you're going to have a variety of opinions that are going to, run the gamut. I'm very happy that we are 95+% vaccinated, and those that aren't, many of them are away from work or working remotely. So if and when you come to the hospital, you're going to encounter 100%, if not 99% of people who are vaccinated. And our policy is, if you are not vaccinated and you are at the hospital, you are tested frequently. So, and you are masked, we are all masked. So a very safe environment, but it's a social challenge. As Amy points out, it's a challenge for all of us to take in all of this information that's being provided and figure out what the right, what the right steps are. So I thank you for inviting me. I'm 4 months young in Sonoma. Joined the hospital in April. And my background, very briefly, is I'm a community hospital person. I believe strongly in the importance of community hospitals and their connectivity and their position as being an entry point into healthcare. I've spent a lot of time in Chicago, and most recently was down in the South Bay. And I am motivated and energized and drawn to communities that are diverse. I feel that that's what makes our country great, and that's what makes our communities great, is a diversity that brings richness to our lives. And you can read that diversity any way you want, from racial and ethnic diversity to socioeconomic diversity to religious diversity. But it's that diversity, I think, that makes life so enjoyable. And I embrace that, and that's one of the things that brought me to Sonoma. The attraction and what I want to share with you about the hospital, what drew me to the hospital was threefold. One was the quality that I saw in the organization. You have highly educated, credentialed individuals on the medical staff, in the nursing ranks, and in the technical fields, from very highly accredited organizations across the country. It's a strong team, strong outcomes, and that's encouraging. The second was, there is a high degree of philanthropic support, and community hospitals, wherever they are dependent upon more than the insurance claims that come in. The economics of healthcare have changed dramatically over the last 20 years, and most community hospitals cannot survive on insurance claims and Medicare and Blue Cross and you name it. So philanthropic support from the community is a vital way to ensure that you have reinvestment in your organization to make sure you're getting strong, high quality equipment and facilities to serve. And then the third attraction was the affiliation that started several years ago with UCSF. Having worked in community hospitals in a variety of places, one of my greatest struggles has been getting the attention of university level hospitals. Your community hospital is not going to do everything for you. They're going to, triage you and handle the bread and butter stuff. But when you come in with something complex, we need a partner to hand off to. And that can be really hard for community hospitals because it's hard to get the attention of those big university entities. And the signal that UCSF has given that they want to be engaged in communities around the Bay Area is very powerful and is very valuable for us and for you because it enables us to fast track cases to the right place. And so I'm hoping, we're not there yet fully, but I'm hoping in the coming years, we will build really strong pathways in a variety of specialty areas so that, God forbid, you come in with a serious problem that we can't address. We know exactly who can address it, and they will either come to us or you will go immediately to them. And that in the community hospital world is invaluable. So that's really what attracted me, is the ability to build out that kind of relationship to enable a community such as Sonoma to benefit the way it deserves from a network within the region. A couple other points I want to touch on, and most importantly is my philosophy is very much that a hospital in a community should not hide behind its walls. We have, I will say, we have the best educated health people in the Valley. We have the most knowledgeable, the most experienced health people. And I'm generalizing. We have a lot of great other people out in the community. Our community health center is remarkable. But there are 500 people in this building that can be great resources across the Valley and across our communities. And we need to get out there and provide that. Traditionally, a hospital waits for you to get sick and then fixes you. That's not healthcare. Healthcare is going out and meeting you where you are and trying to keep you healthy. That's what we need to be doing. And so we've started conversations and begun strategizing on how we can more effectively do that. Now, we certainly need to take care of you if you have a heart attack, if you are in a car accident, if you have a stroke. Those things, we are equipped to address. But preventing the heart attack should be way more valuable to you than healing the heart attack, right? And there are all sorts of strategies and skills and supports that we can provide and we can help our community partners provide so that you never show up with that heart attack. And that's some of the things we're trying to work on. Celia graciously, within the first couple of weeks of getting here, took me over to La Luz to sit down and talk with them about, to understand what they do, and then talk about some of the needs within the community and how we might support them in that. And so we started having those conversations about how we can strengthen our connections and really push our resources out to be a healthcare provider. So that's my philosophy, and hopefully you'll see that and you'll feel that in the coming months and years. One last point I want to make is that I would like to be out meeting everyone, but Dr. Mase just pointed out why I shouldn't. And I've had a lot of requests to come speak and meet and go to various groups, and my answer has been no. I cannot, and Celia will attest to this, I cannot support anybody getting together. This is not the time to do it. And I will accept the wet rag award for being that thing. And that's what the hospital is right now. But the prudent thing for us to do to get past this is to not have fun. I'm joking, but is to not get together in big groups, is to not go inside and do the things that we all love to do. I will put out there, I am happy to meet anyone individually outside. Email me, email the hospital. I will have coffee with you anywhere. But I don't want to come in a group congregate setting and condone that right now, because that's what we're seeing coming into the hospital. I went to my grandma's birthday, somebody wasn't vaccinated, or I'm not vaccinated. Can I get vaccinated now? We're past that, right? They missed it. And so we've got to really keep reinforcing, as Dr. Mase said, those things. Get vaccinated, wear a mask, don't congregate. And it stinks. It's not great, but it's where we are. So with that, I'll kind of turn it back over. Thank you for having me, and I'm happy to answer any questions or accept any comments, good or bad. I really welcome the feedback so we can be the best organization to serve you that we can be.
Thank you so much, and thank you for your presentation. Are there comments from the council? Well, I have one. So I really appreciate your second point about being very community oriented, and I really appreciate that you're looking to push out and do prevention. And I would urge you to check in with there are many organizations in the Springs that are supporting folks, and I would urge you to check in with some of them as well to see how. I understand you're not going to meet in person, and I get that, and I appreciate that too. So, but that there's an opportunity, because there's just a lot of organizations in the Springs that you may want to check in with about how to get that message out and how to build those partnerships. So it's a comment more than a question. So thank you. Are there any other comments or questions from the council? And there's a lot from the. Let's go to public comment.
Yes, Daniel, Fred, and Mario in that order. Give me a second to set up the timer. Fred, go, or excuse me, Daniel, go ahead.
Thank you. Thank you so much for coming and speaking to us. I wanted to ask you, you made the excellent point that the funding model for community hospitals in the United States is in many ways challenging, some would say broken, and relies heavily on philanthropy. And the philanthropy is, certainly needed, and it's certainly appreciated. There is the definite tendency for philanthropy to address those issues that people who have a lot of money are most interested in, which makes it more challenging for philanthropy to cover the areas that don't rise to the attention of the philanthropic class. And I'm wondering, when you run an organization that relies heavily on philanthropy, what do you do about that problem? How do you make sure that you are addressing needs regardless of who holds the checkbook?
That's a great question, and it is ever present in the world. Those giving the money want the influence, and I guess I would say it's an art of graciously accepting while starting from the very beginning with a message of what you intend to do. So if you're very clear about your strategy and the gaps you want to fill, you will attract the people that that resonates with. So you can avoid some of that influence, if you will. Now, I'd be dishonest if I didn't say that the people with money often open doors. And so you got to figure out how to engage people that can open doors, that can access other things that will benefit our community. So I am, I will honestly tell you, I am not going to turn away a dime. But I am going to stay very true and clear in what my strategy is, which is generally what I opened with, which is we need to be healthcare providers, which is address the diseases that are in our community that are showing up in our ER. Diabetes, obesity, uncontrolled behavioral health issues, for lack of meds, for substance abuse issues, you name it. Those are the things that are facing us in Sonoma. And being here 4 months, I can pretty confidently say it because I can see it in our numbers. I can go back historically and look at our ER visits and tell you exactly what's going on. Now, if somebody wants to develop a neurosurgery program at Sonoma because they're afraid of having a stroke when they're 90, not going to work. The numbers aren't there for that. I'm happy to develop the relationship with UCSF so I can pick up the phone and make sure that anyone in that condition gets to the right person. But to me, it's all about setting your strategy and then just walking that strategy.
Thank you.
Fred, go ahead.
Hi, John. Thank you for coming. I have a comment and then I have a question. My first comment is that a number of years ago, someone very dear to me had a stroke, and we went to the emergency room, and Sonoma Valley Hospital referred to California Pacific Medical Center, which turned out to be extremely great because that was the total A team, and Dr. Joey English was fantastic. So I hope that you're still referring there, and that it's not kind of a luck of the draw and you could be sent somewhere where you wouldn't get the A team. My question is a recent New York Times article about hospital pricing and insurance pricing that, you know, if you go, that people can't find out what the price of stuff is, and it costs different for different people, different companies. And why is it that that it seems like we can't get a straight answer on how much some of these things cost? What's up with that?
That is a great answer, and that is one of the few things that I would love to take the fifth on. Not because of any sort of guilt at the hospital, because it is completely, you know, it's been completely warped. As Daniel said, the system is broken. 30-second explanation. Pricing started, Medicare started setting prices and saying they were going to be the lowest cost payer. So whatever your bill was, they had to get the best price. And that turned into a bidding and negotiation war with a bunch of different with various insurance companies. And so you've got all of these levers driving reimbursement, and you have these efforts by hospitals to try to collect enough cash to pay their bills. Most hospitals in our country are nonprofits, so they're just trying to make enough to cover their costs and then reinvest and, you know, buy new equipment or you know, ensure that the hospital has what it needs to serve. But because the insurance companies have 100 different levers, I'll pay you this much for an MRI, but I'll only pay you this much for a mammogram, and I'll, you know, pay you this much for an ER visit of this level versus that level. It's beyond complex. And I have had this conversation with my finance team here and past finance teams. And frankly, the concern is it would be not understood and misconstrued, and it would look dishonest. And I don't know how to get past that. We need to get past that. The pricing it's crazy. It's, you know, for me to make enough money on something, I have to bill it at 10 times its cost so that I can get the cost back. Why would we do that? Why would you walk into a supermarket and see a $20 gallon of milk and know you only have to pay $2.50? That's what we've turned this thing into. It's nuts. I'm happy to talk to you offline more about it because I could go on for an hour, but that's a brief response.
Thank you.
Mario, go ahead.
Good evening. Thank you so much, Doctor. Thank you so much. I mean, dear Chair, Iturri, thank you so much for allowing me to speak tonight again. Yeah, so this comment I really appreciate this presentation by the hospital, and I wanted to just convey my immense gratitude to the hospital, because anytime that I have, you know, whether I have had family members or people that I work with, I advocate for. You know, the other day I had a family from Honduras where I had to take the child to, you know, the middle of the night and have to go with them, and they had someone that spoke Spanish, and they helped them, you know, right away. it's just it really felt like a community hospital. So I feel like I just felt like I needed to say that. It's hard when there is obvious division between the Springs and the city, and it oftentimes feels like the hospital is on the other side of town serving the people with money, right? I mean, so knowing that it, as the only hospital here, it really delivers. It's great. I also appreciate Celia. Celia has for a long time has been doing an amazing job. Trying to really connect with the Springs community, and I think that I feel like she has done a tremendous job, and I really value and admire her. So that was just my comment. I also loved your presentation, the presentation tonight, where there is a intention to continue. I mean, to share this vision of a community hospital. I think that we need more of that. We need more models. We need more organizations to fully commit to working for the community, with the community, and really for the whole valley, especially hospitals, especially when it comes down to issues like housing, health, and education. So thank you so much for the presentation tonight.
Thank you, Mario.
Thank you. I will bring it back to the council to see if there are any final comments before we
Maite, I do have a request.
Sure.
Me hacen a favor.
Sí,
there are not enough Spanish-speaking healthcare workers in our environment.
No.
We really struggle, and I've struggled with this in Chicago, and I struggled this in South Bay. Our care teams don't match our community. If they did, we would have, I don't know, 30% Spanish-speaking employees, doctors, nurses, techs, you name it. And it's really hard to find those individuals, so much so that I have actually asked our HR team to start looking internationally to bring in physical therapists who speak Spanish. That's crazy. Why should I spend $20,000 to sponsor a visa to get someone here that speaks Spanish? So I'm asking you a 20-year gift. Help me recruit kids to go into healthcare. And something Celia and I have started working on is getting into the high schools to get them to do internships at the hospital so they can see what hospitals are like, right? And just getting them exposed opens doors to them thinking about going into medicine and into healthcare fields. So I ask that you help me in making that a reality so we can get more of our Spanish-speaking kids into healthcare. Sorry, thank you. Just want to put that out there.
No, it's an absolute valid, it's the same thing in education. They don't see themselves in the educators either. I see Chief Akre has a question.
Actually not a question, but a comment to follow up. John, first of all, congratulations. I know we haven't had a chance to reconnect since the process, but I am very excited about you in the new position, and I congratulate you and welcome you to our community. I just want to say I totally empathize with the feeling and that sentiment about having a community, a workforce that's representative of our community. And it's something that we have struggled with, but we've had some recent successes. And what we're trying to do is home grow our own people. And so we're trying to reach out, exactly as you mentioned, to the high schools and through Explorer posts and other ways in our volunteer program. We just recently hired 6 of our volunteers into full-time positions and sponsored them into paramedic school. And 3 of the 6 are Spanish speakers. So a huge success for us. And anything that we can do that you and I think are overdue for coffee, but anything that we can do as partners in healthcare for our community and share experiences and successes and opportunities, I am completely in on that. So thank you.
Thank you.
Thank you, Chair.
Thank you. So we will end here unless there's other comments from council. Seeing none. So I just want to again thank the Chief Executive Director, John Henley, and Celia for being here representing the hospital. Very, very grateful to the both of you. And then we'll take a little break. Let's see, what time is it? It's 8:14. So we'll come back. It'll be a short one. We'll come back at 8:25. I know we're going to lose Jordy soon. And then we have Chief Akre, another very busy person in this community who's been with us here this evening to share what's happening with fire prevention and wildfires in our community. So 6 minutes and we'll see you back. Thank you all.
Thank you.
Chair Iturri, my clock says 8:15. Do you want to come back at 8:20?
Oh, sorry. I really need a different pair of glasses. Let's come. Yeah, well, let's make it. Yeah, 8:20, 5 minutes.
8:20.
Sorry, we're
Okay.
gonna lose Jordy.
Okay, yeah.
All right, thank you.
Mhm.
See you in a bit.
We are back. Daniel, we apologize. We missed your public comment in the last item. If you can go ahead and make your comment. And I apologize, John has disconnected.
Oh, thank you. No problem. I raised my hand quite late. I just wanted to comment that, in my opinion, high school career outreach is starting way too late. It would be wonderful if some of the groups that want to recruit locally would come to the elementary schools, especially the elementary schools with significant Spanish-speaking populations. Thank you.
Thank you, Daniel. I agree. Okay, let's see. So Chief Akre, thank you so much for being so patient and waiting. And we all know how busy you are during this season, and we look forward to hearing from you. So take it away.
Great. Thank you, Chair Iturri. I'm happy to be here and absolutely worth the wait. I thank you and the commission for allowing me to be here and chat with all of you. Thank you, Karina, for setting everything up, and Supervisor Gorin, and welcome the community members as well. So a number of things that I want to touch on. First thing that I will mention to just to be really prompt with a response is from our last commenter. As I mentioned to the hospital chair, we do outreach to the high school, but our fire district has outreach to elementary schools for decades, as well as the middle school for their career days in addition. So we do try to outreach as much as possible from a very early age, both in terms of fire safety and community safety, as well as accessibility and career options. So with that, a couple other things that I wanted to touch on was COVID. And I know Dr. Mase is not here, but I see that Supervisor Gorin is still on, and I apologize. I probably should have made a comment while she was still on, but as far as the fire and law enforcement leadership in the county, and in addition to serving as the fire chief for this community, I also serve as the president of the Fire Districts Association of Sonoma County. And so I represent all of the fire districts in the unincorporated areas within Sonoma County. And Dr. Mase has been, and her staff, Dr. Shende, Dr. Baldwin, and others have been incredibly inclusive and collaborative with the development of these last two health orders that very directly and in a really big way affect first responders and healthcare workers. And we, as fire service leaders, as well as labor leaders in the fire service and law enforcement, we've been included in those conversations in the development of these health orders. So I just really want to express my gratitude to that, and having the opportunity to be a part of that, because these are big effects for everybody. I will say, in response to some other concerns that were brought up earlier about first responders and healthcare workers and the percent of vaccinations, You know, I'm very proud of our organization, both our career and volunteer. We have over 100 members that serve our community day in and day out, and we are well over 90% vaccinated. And I think that's something that I'm really proud of. I will also share, I believe, the hospital chair's comments. I'll kind of echo those, that, you know, we're a cross section of society just like anybody else, any other profession, and you know, we have the same challenges that that society has in general, you know, with personal beliefs, whether they be religious or scientific or otherwise. And you know, we're doing our best to try to educate and make sure that our people have the best information that they can to make the best decision for them and their families as far as being vaccinated or not. And we are fully supportive of the current health orders, which mandate that any of our non-vaccinated people are tested weekly, on a weekly basis, and have extra precautions in terms of masking and whatnot to ultimately, what we're here to do is protect our community and serve our community, and we need to do that in the safest way possible. So just want to make those couple of comments, and then I'll move on to maybe what the commission is maybe a little bit more interested in, which is the fire season and our prevention efforts. So I think as I reported the last time I had the pleasure of talking to the group, we're again doing our vegetation management program in coordination with the county. And very happy to report that as of right now, we are about 95% complete with both first and second inspections on the area of the Mase that we targeted this year. We have continued to also include evacuation notices and information to these property owners as we go through the vegetation management process. Very happy to report that in addition to a really overwhelmingly positive reception and response from the community to this program, our crews have noticed in this area what a dramatic improvement it is in terms of just overall fire safety. I mean, these are the crews that go out, and I'll touch on this next, but these are the crews that go out every single year, multiple times, to communities that are faced with an imminent fire situation like the Dixie fire, the Caldor fire, or others. And they know what a safe community looks like, what a safe development or a safe area looks like, and a defendable area looks like. And they've made many compliments to the Springs area that is the target of the vegetation management inspection program this year, about what a huge difference it is in terms of fire safety for that community. So compliments to that segment of the community that has been doing that hard work. I know it's not easy. Also on the prevention side of things, I don't think, I apologize if this is a repeat, but I don't think it is from the last time that I talked with you. But the fire district is very proud to announce that through Sonoma County and some of the PG&E settlement funds, we were able to secure a chipper program for the fire district. So I know the county has done a chipper program, and our chipper program here with Sonoma Valley Fire District is gonna complement that. And so we are now the proud owners of a chipper ourselves, and we will, we're in the process of developing that program, and we'll have that in place before next fire season. So hopefully right after the first of the year, we'll be able to advertise that and take signups and assist community members with chipping their vegetation management clippings, so to speak. Also want to report out on a couple other fire safe councils. The Mayacamas Fire Safe Council, which covers Trinity and Cavedale roads, was also the recipient of one of the county grants. They received $250,000 in funds to do roadside clearance. They have made a remarkable difference on those two roads and in their community in terms of fire safety and egress, evacuation routes and making them safe for the community to get out, as well as, fire prevention, the other aspect of that, which is if a fire were to occur, the spread is going to be greatly limited by the amount of fuel reduction that they've been able to accomplish. So huge compliments to them. Our relatively close to the Springs, the Grove Street Fire Safe Council has also been continuing their work. They recently, I'm going to show you, this isn't a great picture, but I will show, they have just distributed an emergency preparedness binder to local residents within their Fire Safe Council area. So very proud to be a small cooperator with them in their efforts to make their community more fire safe and more prepared. They have also done a number of projects to improve the evacuation corridor along Grove Street and reduce the vegetation there. Next, I want to report out on a couple of kind of current issues. I think one was definitely brought up tonight, and that was the Montini Preserve and the encampments and fire incidents that we've had there. Obviously very alarming for all of us in the community, both as the fire district as well as, just community members. We've had at least three, probably a lot more than three, but at least three significant fire incidents on the Montini and Overlook Trail area. And we have been cooperating with the police department as well as Save the SOS, Kathy King and her homeless support group, as well as CAL FIRE and the City Public Works Department to address the encampments. We have embarked on a program where we, through the Sheriff's Department, we provide anybody that's up there with a 5-day notice, as well as information about services through SOS. And then after the 5-day notice period, they will, the encampments can be removed. So obviously that's a big public safety threat for us, and we're trying to address it in a very collaborative as well as compassionate manner. Another success story for us is we recently had a fire incident, albeit very small, at Larson Park in the Springs. And one of our fire captains responded to that incident. It was reported as a debris fire in Larson Park, and we were able to make an arrest for the person who started that fire. And it was some very, very strong work on that fire captain's. Gary Johnson is his name. He's been doing a lot of prevention work for us here recently. And I know many of you know him. He's been station captain at the Agua Caliente station for years, as well as in the Glen Ellen Station 5, but a real active member and engaged in the community. And he did just a tremendous job in making sure that we were able to bring that person who started that fire into custody. So, last thing I want to report on is just kind of the current fire season. I know that everybody sees the news, and I don't want to harp on any of that, but we're in a really significant, difficult fire season again this year. I think we all kind of anticipated that with the drought conditions that were forecast early on. Our fire district has had crews up on the Dixie fire for going on 6 weeks now. We've had multiple engine companies as well as chief officers helping to manage and lead the containment efforts of that fire. And in addition, we continue when we've had red flag warnings here locally. We continue to be staffed completely at our normal levels here locally, even having crews out on the fires. But when we have red flag, we upstaff even more. And so when we've done that, we had crews that went up to the Cache Fire and helped out our neighbors in Lake County. And so we're in the thick of it. And, just to, reiterate to our community that, as scary as it is right now, our true fire season here locally doesn't start until the end of September or early October. So we need to remain very, very vigilant and very prepared, and do everything we can to make sure that we don't have any significant incidents here in the Valley. So with that, I think that ends my presentation, but I would be happy to answer any questions from either the commission, staff, or any members of the public. Thank you.
Thank you, Chief Akre. It's always a pleasure to have you here and hear all the good work that you and your team has been doing. So thank you. Thank you for everything.
Thank you.
I'm sure we have questions. There's no doubt. And I think Avram has the first one.
Thank you, Chief Akre. Always a pleasure, as Maite says, to have you here, because you're really the go-to person for our survival in the Springs. I have a couple things. One, I'm glad you brought up the homeless encampments in the Montini Preserve. We know what happened in Lake County, and which could have been a whole lot worse. Fortunately, they got on that fire very quickly, or it could have been devastating. The question to me, I understand really being compassionate, but a fire can start at any time. We have a wind that comes up, somebody's doing a campfire, and before you know it, the whole hillside's on fire, and we got a conflagration. I guess to me, and I read the article in the IT, I understand the compassionate side, but I think there should be zero tolerance. I mean, what we're talking about, you have the rights of a couple people to do the right thing versus a whole community that could be destroyed. And I don't get it. I don't understand it. But it would seem to me, first of all, they can't camp up there. I know that's illegal, but I think we're playing, excuse me for the pun, we're playing with fire. So I know we gave them till September 1st, but if something started next week and got out of hand, nobody's going to feel real good about that. So that's just my input. And I think everybody in the Springs feels, or many people feel that way, but we need to figure out how to do it compassionately and pack people up. They just can't have a week or 2 weeks, or, I know you gave the 5-day notice, but I just think something should be done about that. We talked about AB 38 last time a little bit. I would like to know, how many houses have you, sort of gone out to and done the inspection? I don't know. I can't tell you how many households there are in the Springs, and there's certainly areas that are more impacted than the others. And I'm just thinking about my area of Park Avenue and off of Mountain, which is the beginning of Agua Caliente Canyon, which is ton of fuel here. We've done the best we can in our house to cut down trees and give the distance between, but I see a lot of houses in our area. I mean, trees are right next to the house, overgrown. I mean, it's like a Roman candle in our area. Are there any plans to try to manage and deal with that?
Okay, so to answer a couple of your questions, I fully Avram, I fully appreciate and agree with you in terms of the fire safety and public safety risk of Montini. I am not the legal expert, so when I'm told that that they're giving a 5-day notice to existing people that might be encamping on the hillside, I think that's kind of where that compassion comes in. I know that we've also had conversations with the City Public Works about sign postings, and that's probably something that we've been remiss on in the past because it hasn't been an issue. But posting very prominently, no camping. Camping's not allowed. No overnight. Park is open. Trails are open. Dusk till dawn. That's it. Anything else will be removed. I think it's unfortunately we're kind of being reactive to something that wasn't an issue. Even last year this wasn't an issue for us. So I know that there's a good group of people that are working very diligently on this. Chief Rodriguez from the police department, who's also the lieutenant in the Valley and serves the Springs, has been just phenomenal on leading this charge really aggressively, but also in a collaborative and, again, compassionate approach to anybody that still might have been up there for a while. So we're trying to do everything we can. We've also engaged our CAL FIRE partners because, again, as you said, you mentioned the word conflagration, and that's something that none of us want to see, but very quickly as it exits the city's responsibility on the Overlook Trail, it gets into the CAL FIRE area and the state responsibility area. So we've engaged with our CAL FIRE partners very early on with this to help. And just as a little bit more information, not that this is directly to Montini, but it certainly applies there, but it applies everywhere in the state responsibility area. CAL FIRE's taken a very different approach than what they've done in the past. In the past, it's been warming and cooking fires have been kind of allowed, and now they're no longer being allowed. So every fire in the state responsibility area is responded to. It's put out. There's a report taken on every single one. So I don't know that that's the complete answer you were looking for, but I do want to share that we take this very, very seriously, and we're trying to respond as best as we can, and certainly more assertively and aggressively than we have in years past.
Thank you.
And then second comment or question you had was about the vegetation management. I think it's in a perfect world with unlimited funding and unlimited capacity for departments, whether it's our department, county department, public works, we could tackle wide spots in 1 year. But it's kind of like an elephant that we're trying to eat one bite at a time. And we were the first district to start in on this program with the county in the pilot program, and we've been doing it for 3 years. This year we're doing about 300 properties in the Springs, and even to do that, we have to hire back extra help to be able to provide those inspections. We just don't have the capacity within our prevention folks to do that within existing workloads. But I think all of the efforts that we're putting forward, like I mentioned, the chipper program, all of it adds to, trying to address it. And when property owners do, like this year, what we've seen, when they do a very thoughtful and complete job of addressing their property, well, for the next 2 or 3 years, we don't have to focus on those properties. We can turn our attention to 300 or 400 more properties next year and get them to be more fire safe. So, and then the last thing I'll say is on that note, and this is a little bit of a plug, I'm going to be honest. I'm part of a leadership group within the county that is working on putting together another countywide sales tax for fire services to improve both fire response as well as our ability to do things like vegetation management. And so that is yet another approach that might be able to help address some of this. So I'll be talking to this group more about that as we get closer, but we're targeting June of 22 for that that next measure.
Thank you.
Thank you.
Seeing no more comments from the council, we'll move to public comment. There is one in the chat that I want to ask Chief Akre.
Okay.
It's about weed abatement. Is there a deadline for Sonoma County and the Valley? Is there a timeline when people need to have their properties cleared?
Thank you for that. I just saw that as well. There is not a hard deadline. We do put out weed abatement notices to our, what I will say is our normal group of vacant lots and also properties that have been the subject of inspections in the recent past. We put that out in early May. So we encourage abatement early in the season, but there's no firm date, you know, as it kind of slides each year based on rainfall and what the conditions are. But if anybody has a concern about a property, whether it's theirs or a neighbor's property, we are always open to hearing those. Back to Avram's question about the vegetation management inspections. If a community member wants a vegetation management inspection, contact us and we're happy to do it. We'll add it to the list. In terms of weed abatement, anything that people consider to be a hazard in the community, we're happy to send an inspector out and take a look at that and evaluate that. They can either call our business number 996-2102, or we do have an online reporting mechanism for weed and hazard abatement complaints, and that's at svfra.org. So and we continue to receive those complaints all the way through the very end of fire season, and we'll be responsive to them as soon as they come in.
Thank you so much. I think we have a public comment from Daniel and then Fred.
Yes, Daniel, go ahead.
Thank you very much, and thank you, Chief. You actually answered already a couple of my questions. Thank you for being so thorough and informative. One comment that I wanted to make, and I wanted to see to what extent it's on your mind. There has been historically a very strong pattern of wildfires to the east of Sonoma Valley in the Mayacamas, and very few to the west in Sonoma Mountain. When I talk to people in the community, they often say, oh, Sonoma Mountain doesn't burn, the soil is different. And I've spent quite a bit of time for my work up in the Sonoma Developmental Center property and other parts of Sonoma Mountain, and it is just extraordinarily dry up there. In addition to which, because most parts of it haven't burned in at least several decades, there's an extraordinary amount of fuel. And I'm wondering if that, because of the drought, conditions are different, the risk of fire on the opposite side of where we're used to thinking of it, of the valley, is on people's minds, and what, if anything, can be done about the fact that there's just so much fuel all over Sonoma Mountain. Thank you.
Thank you, Daniel. So in trying to answer your question, I've studied the history. The history of fire in the valley is very, very prominent on the east side in the Mayacamas range, dating back to 23, 46, 64, 80, and then, as we know, in 2017. And I think there was one even in between there, between 80 and 17, and I forget the exact year. But we've had a very regular and prominent history on the east side. And, you know, I think some of that has to do with, and forgive me, I am not a fire scientist by degree, but you know, I do know fire science to a certain level. You know, the fuel, the weather, and the topography are the things that affect fire behavior the most. And on a west and southern exposure that is exposed to the sun the most, as well as our typical patterns of when we get fire weather, we have the offshore winds that come from inland and are predominantly in the higher elevations like the Mayacamas. They come from the Great Basin and move west. I think that puts I think that all kind of compounds to show what our history is. We have not had a significant history of fire incidents on the west side of Sonoma Mountain. And I think some of that probably has to do with the fog influence that we still get coming over the hill a little bit from Petaluma. I think it also has to do with the aspect and then the wind flows. But all that being said, am I still concerned? Absolutely. You know, we encourage for example, the Grove Street Fire Safe Council. They're doing a lot of good work up there, and that's on Sonoma Mountain. So we encourage community vigilance. We encourage fire safety and emergency preparedness throughout our service area. And we definitely maintain our vigilance as a fire district throughout our service area. But past that, I hope that answered your question. It's a tough year all the way around. I mean, I think the most recent thing we've had on Sonoma Mountain was maybe when in 17, when it kind of skirted around close to the west side of Sonoma Mountain through Bennett Valley. But that's been the closest that we've experienced in terms of any sort of significant fire incidents up there.
Thank you. Fred?
Yes, Fred, go ahead.
Hi, Chief Baker.
Hi, Fred.
I'd like to just compliment the MAC on having a great lineup tonight. This has been a really good public meeting. All the speakers have been great, and some nights you just feel really proud to be a community member, and tonight is one of those nights that I feel that way. Chief, I believe you are a local product, so maybe after I've done with my comment, you could mention if you came up through the system here through a result of local recruitment. Then I have a question about the Grove Street and Veg Management Program. I happen to have been working on Sonoma Mountain, and I go up all the way over the top and drop down a little bit over the other side. And all I've seen done so far is what seems to me to be a paltry amount of trimming down along the bottom that still left a lot of canopy there. And I'm driving through canopy a lot of the way up the road there. And one of the last couple of weeks, you know, I said to my partner, I said, there's only one way out of there, right? You know, I mean, I'm up there, I'm going, if something goes, you know, how am I going to get out with all those trees next to the road? So I was just curious, you know, is I don't know, the veg management that was done there, was that with county funds that was done right around Westerbeek Ranch, or was that a private effort?
Thank you, Fred. So to answer a couple of your questions, First of all, local recruitment. I think I'm kind of a hybrid. I was raised here and started out as a volunteer with the Sonoma Fire Department back in 1988 when I was still in high school, and stayed as a volunteer here in the Valley for almost 30 years, and then was recruited back to my current position as fire chief back in 2017. After spending 27 years in Contra Costa. So definitely still very much a member of the community. And I think those connections, you know, and that involvement definitely played a part in me being able to be in my current position. And I'd like to say have set me up for greater success here. And I can't tell you how proud I am and honored I am to be able to serve my hometown and my community in this role. In terms of the vegetation management, actually one last thing, and I didn't mention this previously, but you know, our district has had a community-based driven strategic plan for about 10 years now. And a very integral part of that that strategic plan is home growing our fire department. And so that's one of our major goals within our strategic plan, within our organization's strategic plan. And so I think that's an important note to make to the group and the community, that this isn't just you know, it isn't a matter of convenience. It isn't a matter of lip service. It truly is who we are. It's a value of our organization and something that is within our strategic plan that the community helped to create. And I think that that helps frame the importance of it. And then your second question about Grove Street is, you know, Fred, as far as I'm aware, the Grove Street Fire Safe Council has not received any county funds. I don't believe that they received anything in the latest PG&E grant round that the Maya Kamas and the fire district received funding for. But that group is kind of in its infancy, and they're trying their best to you know, seek out grant funding and opportunities to create more fire safety. And again, it's not, you know, if unfortunately we don't have unlimited funds and opportunities to make all of the difference all at once, but they're putting forth some really good efforts to make their community, and as you said, that is a one way in, one way out, and that is their focus, to make that exit corridor and evacuation route more safe and more viable. So I know their efforts are going to continue.
Thank you. Thank you, Chief Aker. I'll bring it back to the council for any final comments. Seeing none. Chief Aker, thank you so much.
Thank you, Chair.
We look forward to seeing you at your next visit.
Absolutely. I look forward to it as well. Thank you all very much for all of your continued efforts on behalf of our community.
Thank you, and have a safe September and October.
Thank you. Thank
you.
you.
All right. Take care. Bye-bye. Okay. That takes us to the ad hoc reports. And Jordy, I don't know how much longer you can stay with us. I just want to check in with you really quick. Or did he leave already?
He had to go, yes, unfortunately.
Okay. No, I understand totally. So we'll go through the ad hoc reports. Dana, are you here? Would you like to do a map your neighborhood update?
I'm here. I'm always here just listening and
I know. And you've got
taking care of dinner and everything else.
You've got that sweet little child there with you too. So go ahead.
Yes, going to the fabulous El Verano preschool also.
Good to hear. Good to hear.
It's been a good week getting back to some kind of normalcy.
Good.
But on that note, outreach for Map Your Neighborhood is kind of, I don't want to say at a stalling point. It slowed a bit just because of the variant. We haven't had the in-person opportunities as much. So just really asking on a personal level between folks, between neighbors. Hey, my neighborhood's doing this. Have you guys heard of it? Just spreading the word on a grassroots level. That's really where the most meaningful outreach I feel like comes from. We did host a block leader meeting in August. Thank you, Iris, for your help. It was a small group, but we had a super productive meeting, and some projects. I've picked up some projects that I'm working on, actually mapping like exact homes between each group, just to get a better sense of, you know, who's participating and which neighborhoods are more thoroughly covered rather than more spaced out. So I've picked up that project, and we're just continuing to move forward. There's been, I've mentioned it before, but it was mentioned in the leaders meeting, and I just really want to give a huge shout out to the crew. I guess you would say east of Central, up the hill of Boys Hill. Just incredible. They've been, you know, even the groups, there's a couple groups that aren't active in Map Your Neighborhood, but they're active in their own way. And it's just really, it's really heartening to see that. And the neighbors up there have been making great progress. So good teamwork happening.
Thank you so much, Dana. Appreciate all your efforts. And
thank you guys for all your support.
Yeah, I really just want to, I always want to shout out that we are the only ones who are doing a bilingual Map Your Neighborhood. I just think that's so important. So Dana, thank you for using your language skills to make this work as well. Iris?
Muted.
I wanted to add that we are now looking at having a leader, co-leader meeting every month. That's, you know, to hopefully spur things on.
Thank you. I also want to add in this section that we took receipt of a Connex trailer that Supervisor Gorin mentioned, and that many of us were there to receive it. It is on the Altamira campus, and it has supplies that we are continuing to add more supplies to it, but we do have a small stash of supplies for if we were to have to open a shelter in our area. So very grateful to Department of Emergency Services at the county, the Red Cross, Map Your Neighborhood, all of the folks who've been working on this effort. So thank you so much. Mari, did I see your hand go up?
Yes, two things. One, that we were also working with Dana, trying to get the evacuation packets from the county to be able to provide at vaccine clinics. With the Delta variant right now, it's the neighbor fests are on hold. And so that would be kind of in lieu of, and also working, there's interest from the Mid-Penn apartments from Fetters and Celestina to organize their tenants. So that's something that will be coming, that Map Your Neighborhood will be part of as well. So just, I know it's a lot and sometimes we forget, but just wanted to put that out there.
Thank you for mentioning that, Mari Carmen. I wanted to plug both of those, but I feel like you guys all did so much of the work. I was kind of the late comer to, especially with the Connex and all of the work that went into getting all of those supplies. So I didn't want to take that, but thank you for mentioning that, Maite. It's really awesome to be a part of something so great with you guys. And yeah, I'm looking forward to getting Fetters apartments. That'll be a really big, great outreach opportunity, and to get more neighbors prepared. They've been really eager to have us present too, so it'll be really nice to connect with them.
Great. Thank you so much to all of you for all your efforts in that. We'll move on to Fire Safe Council, Ray.
That's great. I'm trying to figure out, Iris, how maybe we could recruit at your leaders and co-leaders meeting, because what we really need is a board for the Fire Safe Council. And how do we integrate that into that? I have nothing new to report except that you know, time is running short for me, I think, for this council. Our anniversary, I think, of our first meeting was in March. So February, I think, would probably be my last meeting. So we'll need to work on something with the Fire Safe Council in a transitional way to move that work somewhere else.
How many
So
more people?
I'm hoping,
Oh, sorry.
you know, we could get, so we would need a board of some sort, whatever it is, you know, required to form the Fire Safe Council. Maybe we can have a meeting after this and talk about this more.
Thank you, Ray, for all your efforts to make this happen. Okay. Avram, would you like to report on our limited progress?
I would say it's a bit limited. Part of it is setting up a meeting with the people that we'd like to have on the ad hoc committee. And those are the people at Artiscape. They seem to be vacationing a lot this summer. So Maite and I have gone over a number of projects that we think would be important for the Springs. Unfortunately, we're not going to be able to have a meeting with the people from Artiscape until the week of September 5th. So we'll have more to report the end of September. There's one thing I would like to mention because, and I wish I had included it in our package today, and maybe we'll do it next month. In the West Berkeley section of Berkeley, as you enter West Berkeley, there's a beautiful mural saying "Welcome to West Berkeley," and it's on a private building. They allowed that to happen. I'm going to submit to our group that it would be great to identify maybe other buildings here in the Springs that might be willing to have a mural, because that would give us great identity, and it would be a real lift, I think, for the Springs. So more to come. I'm sure once we can get together as a group, we'll actually have some content. So thanks.
Thanks, Avram. So our communications outreach, I want to thank Hannah for all her work on getting communication out there. And I think you and Jesus have taken on the communication work.
Yeah, we met and kind of thought of an idea of identifying organizations in the Valley that we would like to make stronger ties with. So we were just working on identifying the organizations, and I have a meeting sometime in September with the Boys and Girls Club. And then also I'm just trying to promote us on Nextdoor and Facebook pretty much. And we're also going to be putting out translated notes from the notes I take. So Jesus said he could translate for me.
Thank you. Thank you, Jesus. That's great. Thank you both. This was a big need for us. So really appreciate both of you taking that on. Are there any questions for anyone on the ad hocs at this point? Okay, great. All right, thank you all. We'll move to consideration for future items. Ray, is that you?
Yeah, that's me, sort of. Weird filter. Yeah, would you guys be interested in receiving, if it's gonna be one, just a short briefing on the ARC and what we're doing, the Advisory Redistricting Commission, the rules that we're going about, kind of what we're encountering, and the tools that we're using. I'd be happy to do that.
That'd be great. Thank you, Ray. And what's the timeline of your work?
I would say the sooner the better, because our work is happening quickly and it's dynamic. So I would say the sooner the better. In fact, to get participation by the required, I think we need it by October. So I would say if we could do it in September, that would be best.
Thank you. I think I saw Iris's hand.
Iris, you're on mute again.
I was having finger problems. Sorry. Yeah, I would like to see us discuss a way to streamline the presentations. They were all excellent tonight. What I'd like to say is that we do receive materials ahead of time. And if those could also go out to via the announcement to members of the community who are interested in hearing these reports so that they could review them ahead of time, it would hopefully streamline the presentation time. It's possible we could also send in questions ahead of time to the presenters so that the whole process went more smoothly and took up less of everyone's time. It's county employees, it's Jordy, it's all of us who are here. And it seems important. We need to have more community involvement, and I hope that would lead to more community involvement. When these run so late, it's difficult for community members.
I'd like to respond to that, Iris. Actually, the material does get posted. I personally make sure that it gets posted on the Springs MAC page, which the public has access to, but I personally also email the council.
Yes,
all the
I
material
know.
that is, yes.
Oh,
So
yeah.
the material is available for the public. And we
okay.
do accept public comment in advance of any meeting. I think only once have we received a public comment via email.
Yeah.
And I know that we will be discussing with Chair Iturri and Vice Chair Willett the opportunity to reopen the chat. In the past, it's been closed because of potential bombing.
Mhm.
But I'm happy to, work with Chair Iturri on reopening.
I was unaware that it was posted to the public, so that's great. I'm not much of a Facebook fan, sorry.
Thank
It's
you.
It's on the Springs MAC official website, not the Facebook page.
Oh, okay. Thank you. Thank you.
Mhm.
Okay. Anything, Avram, is that your hand up there?
It is. It is. I don't want it to be Groundhog Day, but here I am at Groundhog Day. Still, no updates on the spring specific plan. It would be great, whoever in charge of it. I don't know who's in charge of it, but it would be great to get at least an update on where it is. We're coming up to the 7th year anniversary. The other thing is, I know that Supervisor Gorin sort of suspended the Plaza Audit Ad Hoc Committee because she was working on something. I'd like to know, it would be great to get an update on that. And also sort of in conjunction, any of the other projects we have going in the Springs. So since our representative from, Joanne Brown isn't here, so she can't update us on projects. So it'd be good to get an update from somebody. That's it. Thank you.
Thank you. Anyone else? Okay. All right, we will look at these and put them in. I'm sorry.
I'm sorry. Hannah had it looks like a Matson's update.
Okay.
Yeah.
I think we have them coming back quarterly. I'm not
Okay.
sure when they're coming. I'm not sure when they're due to come back again.
Okay. Thank you.
Okay, we'll continue to plug these in where they fit. I think there's some urgency around Rays to get that in there, and maybe we can get some of those updates that Avram is talking about. Okay. So it's time for adjournment. Look at that. If there's nothing else.
Move to adjourn.
Well, let me thank everybody. Hold on. Thank you to Supervisor.
Okay, sorry.
KSVY, always Bob Taylor for hanging with us, Lynn Marie, Jordy for staying with us as long as he could. We appreciate you all. I look forward to this. I think today I agree with Fred. It was a great lineup of guests and really good information. So it was a great job. Thank you, Karina, for all your work to make all this happen. And thank you to the council members. It's always a delight to spend Tuesday evening with you. And if there's a motion to adjourn.
Motion to adjourn.
Second?
I'll second.
All right,
Second.
all in favor?
Aye.
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 Okay, our meeting is adjourned at 9:14. Thank you.
Okay, bye.
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 Thanks,
Aye.
Livery.